to the SAFE Network webinar on COVID-19 and immigrants in detention. I'm Annie Chen from the Vera Institute. It's so great to see so many people join us today. I deeply appreciate it, given how much all of our professional and personal lives are under strain in this new reality. At a time of fear and scarcity, it's so important for us to come together and ensure the health and safety of everyone in our communities, especially those most vulnerable. So I feel really lucky and motivated to count all of you as colleagues and as allies. The goal of today's webinar is to urgently convey what's happening with immigrants in detention during this pandemic and elevate the very real public health concerns. As more and more staff and people at detention are getting sick, fears of immigrants trapped in detention with COVID-19 are unfortunately coming true. As federal immigration enforcement targeting our communities has continued, you may have even seen the reports of ICE wearing N95 masks while making arrests recently, when we know that there's a shortage of masks for medical professionals. And as more people are needlessly brought into detention, the threat to the health of immigrant staff and our communities is compounding and deepening the crisis. Today, you'll hear the public health perspective from Dr. Homer Venters. You'll hear a national perspective on the federal government policies that are deepening the crisis. Then you'll hear how legal defense programs in your jurisdictions on the front line are locally responding to the crisis and really are a lifeline for people in detention. Finally, we'll talk about how you can take action. Local leadership has already been at the forefront in the coronavirus response, and as part of the SAFE Network, funding deportation defense programs, you already are national leaders in standing up for immigrants in your communities, and your leadership is of critical importance now more than ever. Let me cover some logistics for the webinar. So we're all doing this from home. So fingers crossed that things go smoothly. Please bear with us if we have any technical issues. If anyone, including panelists, get cut off with Wi-Fi, you can call back in with a phone. There are numbers that are part of the Zoom invites that you received. Everybody, the participants are muted. So we ask that you use the chat box in Zoom, not the Q&A. To communicate. That way everybody can see the questions that you're asking or the comments that you're making during the webinar. Even though we have a lot of people on the call, we'd love to use this as a forum for us to share ideas amongst this peer group around government responses. During the webinar, so feel free to share what policies or actions your jurisdictions have taken or are considering specific to immigrants in your COVID-19 response, and any lessons learned that you can already share. Please remember to put in your name and where you work, your jurisdiction, so that everybody can do that, can get that information and reach out to you if they have any questions afterwards. And also, we're going to have a facilitated Q&A at the end. So we ask that everybody put the questions in the chat function as well, throughout the presentation, and I'll be reading out the questions and directing the questions to the different panelists at the end. Here on the screen right now, you see a map of the SAFE Network currently. We are 18 jurisdictions strong, and I believe all represented on this webinar, so thank you very much. All right, I want to start with voices from inside detention. A content warning, I'm going to play a 90-second clip of people detained inside the Mesa Verde Detention Center in California, and it really shows the dire situation of people in detention. The clip was released by the Interfaith Movement for Human Integrity. So let's give us a minute as we pull up that video. I think this might be our first technical issue. All right. Yes, could you please play the video? Thank you.
Many of us have underlying medical issues, from asthma, diabetes, tuberculosis, valley fever, to heart issues like Hans, who is 75 years old and suffered a heart attack last week. This would turn our detention into a death sentence because this pandemic requires social distancing, and that is impossible in this environment. There are 100 bunks in one room, not much space or privacy. Cleaning supplies are diluted and ineffective when we do get them. They are not able to handle this outbreak. There is no screening, even for those with symptoms. Employees go in and out of the facility and don't even wear gloves or masks when they walk into the dorm. We request that you give us parole, pardon, or bond so that we may return to our families, especially during this pandemic and the strain we could have on an already stressed medical system. With much respect and urgency, let's avert the dorm C.
The message is powerful and it's loud and clear. COVID-19 will turn detention into a death sentence unless people are released. So about 2 weeks ago, Vera and Community-Oriented Correction Health Services created a set of fact sheets related to COVID-19 with guidance for government. I'll briefly talk about the immigration guidance, but I also wanted to let you know that my colleagues here at Vera put out fact sheets for the range of criminal legal system actors like police, prosecutors, defenders, courts, jails, prisons, parole and probation agencies, among others. So if you or any of your colleagues would find it useful, my Vera colleagues would be more than happy to speak further with you. Feel free to reach out for more information. It's all on our website, vera.org. So here is a very brief description of our two-pager and the recommendations. Really, the goals are focused on prevention, containing the spread of COVID-19, and responding to active cases and detention while preserving due process. And the very key top-line recommendations really are halt enforcement, release everyone, starting immediately with those with vulnerabilities, eliminate community check-ins, stop deportations, and focus on releases. No using solitary confinement to separate people with symptoms, and ensure that people can meaningfully contribute to their legal cases. They're still in detention. So you can go to vera.org to read the full document with the detailed recommendations. Please share it and please use it. With that, I would like to introduce our first speaker, Dr. Homer Venters of Community-Oriented Correctional Health Services, which co-authored the guidance. Let me briefly introduce him. Dr. Venters is a physician and epidemiologist. He's a nationally recognized leader in health and human rights. He's currently the president of COCHS. Previously, he was the director of programs for Physicians for Human Rights and the chief medical officer for the New York City jail system. He's also the author of Life and Death in Rikers Island. He's also been recently involved in litigation to release people from ICE detention as an expert witness, and I've heard that his affidavit has been cited more than once. Dr. Venters, would you like to add any comments about the policy brief that we put out?
No, I think those are great top line summaries of the critical elements. Thank you.
Great. So from a medical and public health perspective, can you talk about why detention is so dangerous during a pandemic?
Yeah, I think that people on this call are probably more expert than most public health professionals about how it is places of detention really promote the spread of communicable diseases. I think we know that, all of us, that these are very congregate settings. People are crammed together in very small spaces. There's really no ability to engage in social distancing as one of the primary tools that we hear about and practice every day, hence our presence on a web call or webinar. But also we know that these places have been bereft of anything close to adequate health services since their inception. And we know that most of these facilities are quite filthy, unhygienic, and people lack most basic infection control tools like hand washing, access to soap, paper towels, or hot air dryers to wash their hands. And so I think we know that these are places that promote the spread of infection, that we've filled them up with people that have a lot of the risk factors for serious illness and death that we've all heard about, and that they're run and designed in a way that it makes it very difficult to detect or to advocate for oneself or one's neighbor when somebody does become sick. And then there are many barriers we know about to accessing hospital level care for the people that do get very, very ill. So it's really a worst case scenario that we've designed and implemented through a series of policy misadventures. Did you want me to go into any of the other parts, Amy, either talking about a little bit about the kind of like why some of the standards that have been rolled out aren't going to be effective, or maybe a little bit more granular detail about how disease is spreading through these ICE facilities right now?
That would be great. Thank you very much. I was just muting myself and muting myself. Please go ahead.
Sure. I think that one of the things that we're all seeing is that there have been protocols and policies circulated in almost every one of these places around the country. And I think that some of them are woefully inadequate, and some of them on paper look close to what we would think of as like traditional infection control policies. I think that, and the point I'm trying to make with colleagues at the CDC and elsewhere, is that you can't simply take hospital level infection control policies and then put them down on the desk or at the doorstep of ICE detention settings, because these are places that are completely ill-equipped to implement any of these practices, or at least most of these practices, in a way that's going to save lives. And so sorry, I'm back. But the fact that these facilities have been run in such an unhygienic way makes it unlikely that basic infection control will be implemented simply because we care about it now because of the coronavirus. I think also the lack of staffing that's happening right now today, as staff become sick, health staff and security staff, it makes it even less likely that this work will be done. You know, we should think about this as a time where probably twice as much work needs to be done behind bars in a detention setting than before this pandemic. If you look at all of the infection control measures that the CDC contemplates, they're just something as simple as the social distancing, this kind of fantasy that you could have 4 people here out at a time at different tables, 1 out at a time, shower, rec, food, all of that stuff staggered. That takes more staff. A lot of the staff are gone. They're out sick. That's going to be an increasing problem every day. It's going to be harder not just to do the day-to-day management of these facilities, but it'll also be almost impossible to get people to the hospital when they become very sick. So the notion that we can implement these community standards of infection control in places that have been forgotten about for decades flies in the face of reality. And simply having a somewhat adequate policy on paper does not mean that this system is making or engaging in an appropriate response. We know that the primary response we need is to get people out in order to save their lives.
Annie, if you can hear us, that you're muted.
Thank you, Dr. Venters. And So I think that you've made a clear connection about why, trying to release people from detention really is, unless we release people from detention, it's impossible to implement the same sort of health standards that we're asking people, like social distancing, adequate medical health care. It's just not possible to provide in the current sort of system that we have in ICE detention. So I think I'm going to turn to Heidi, and let me introduce her. Heidi Altman is the Director of Policy at the National Immigrant Justice Center. Previously, she served as the Legal Director for the Capital Area Immigrants' Rights Coalition, and she also runs an advocacy listserv and regular calls on immigration detention accountability. Heidi, could you give us some background on the current federal government policies at a national level during this pandemic, and why some of them might be a problem?
Sure. Thank you so much, Annie, and thanks to all of you who are taking time when life is frenzied to participate in this call. As Annie said, the National Immigrant Justice Center, we're a legal service provider providing representation to immigrants in and out of detention in the Midwest and throughout the country, and I'm here in our DC office. I am so glad that there are other legal service providers on the call today too, because I feel like it's challenging to convey, and I'm going to do my best, but it's challenging to convey the depth of the urgency and the fear and the feelings of helplessness that my colleagues and I are hearing from NIJC clients inside of detention, their loved ones outside, and immigrant communities at large still facing immigration enforcement. We're so grateful and lucky to have Dr. Venters and other leaders who have laid out these very, very clear sort of unanimous recommendations for the way that the Department of Homeland Security and ICE should be responding to this pandemic. And I can't overstate the severity with which we are seeing the opposite reaction and response coming from DHS leadership and directly from the White House. So I'm gonna talk through sort of at a high level what we're seeing in terms of federal enforcement and detention, and then I know that my colleagues at various other legal service providers are going to dive into what they're seeing on the ground. But I want to note at the outset that this sort of national disaster that we're all living through for immigrant communities and for immigrants inside of detention is being layered on top of a system of enforcement and detention that was already sort of rotten to its core with abuse, and abuses that at this point are really sort of perpetuated by government actors. And that is making the additional threat of the COVID-19 pandemic particularly frightening, not just for immigrant communities, but for all of our communities who stand to suffer, as Dr. Venters has explained, if these precautionary measures aren't taken. So I'm going to start with some numbers, so bear with me, but I think it's important right now. So what you hear from Dr. Venters as others is what is needed right now is a suspension of civil immigration enforcement and mass releases of immigrants from detention, with a reminder that those who are in ICE custody are all there because of a civil proceeding, so that they're all either arriving asylum seekers who were transferred from the border or an airport, or they are folks who were picked up inside of their communities, but are only in detention because of a civil immigration proceeding. And if they do have criminal convictions on their record, already have the time and completion of a sentence imposed by the criminal court behind them. So what do we have today? We have varying numbers as the weeks go by, but in the month of March, recently posted data by Immigration and Customs Enforcement tells us that ICE has what they refer to as booked in, which basically means arrested and taken directly into detention, nearly 10,000 people for civil immigration enforcement arrests just during the month of March, which we all know has really run the course of the pandemic thus far. That's 10,000 people now in these very dangerous conditions who do not need to be there. You may hear and see that the numbers of folks in immigration detention is decreasing in recent weeks. And that's true, but I want to provide some really critical contextualization, which is that at the same time that ICE is persisting in systemic enforcement and mass detentions, they have also closed the border to asylum seekers and even to unaccompanied children. And so basically no one is getting through the southern border to seek asylum, which means that the numbers coming into detention from, you know, what the government refers to as border apprehensions is plummeting. And so the decreasing numbers in detention is not a reflection of a meaningful action taken by the government toward releases or decreases in enforcement. That's what's happening in detention in terms of the numbers. The other thing I will flag is that some of you may have seen an announcement about 2 weeks ago out of the White House from the acting director of ICE, which gave some of us some hope for a minute, which flagged essentially a new directive that would decrease enforcement, or at least increase the use of prioritization in enforcement. Subsequent reporting has revealed that that directive faced immediate backlash directly from the White House and from Stephen Miller in particular. And so I think what you've heard from Annie, and I'm sure you'll hear from others on the call, is that we don't really see any meaningful impact of that announcement, as reflected by the number that I flagged already of nearly 10,000 folks being picked up and taken into custody just this past month. You're going to hear from other service providers. What we're hearing from our clients is that they don't have access to soap. They're in crowded dorms. They don't have access to cleaning utilities. Their families are very scared. And the note that I think is most important that I want to close on here is that in the immigration enforcement system, perhaps uniquely, the steps that Dr. Venters and others are recommending are completely doable, legally, ethically, and otherwise, right? So this is a civil immigration enforcement system. Suspension of civil immigration enforcement is completely doable without hampering any of the criminal enforcement activities that might be deemed necessary in other federal agencies. And within the detention system, ICE has full legal discretion to release everyone in custody on humanitarian parole, either on recognizance, on parole, or through alternative to detention programs, some of which do provide things like telephonic check-ins and other supervisions. This is doable, and you know, for some of us it feels like an irony that this has been doable for years, right? Many of us, including NIJC, have been calling for the dismantling of the system of more than 200 jails and prisons that now, as you heard from those inside, have turned into what feels like a death sentence and may actually be for so many. So I'm going to close on that note. Your voices, those of you who are on this call, who are in local leadership, your voices are so critical at this moment because our federal system is failing immigrant communities. It is failing vulnerable asylum seekers and long-term residents of our communities stuck behind bars for no reason. And it is failing all of our communities because, as you heard from Dr. Venters, the repercussions of what could be a catastrophic outbreak within these facilities comes out into all of our communities. So we appreciate all you're doing, and I'm happy to answer questions with regard to asks at the federal level, and really grateful to Vera again for putting together this call.
Thank you, Heidi. Yeah, that was great. And maybe in the Q&A, if we have time, we can talk about just generally some of the advocacy that's happening at all levels. There's so much right now. You know, there's litigation, there's increasing protests, there's really a great, amazing communications effort. So I'm hopeful, right? Like a lot is happening right now on this issue. Let me turn things over to Courtney Lee. She's a senior program associate here at Vera, a site lead for a number of the SAFE network sites. And she's going to facilitate the discussion with the legal services providers in our network who are really on the front line, a lifeline to people who are in detention right now.
Thanks, Annie. And thank you so much, Heidi and Dr. Venters, for setting the tone for this conversation and giving us full context for this. Like Annie said, I'm a senior program associate at the Vera Institute. I started in November. I met many of you all at the November convening, and I'm currently working with the sites in Ramsey County, St. Paul, Minnesota, Dane County, Madison, Wisconsin, as well as our Texas sites in San Antonio, Austin, and Dallas. So I'm going to facilitate this section with our panelists from the legal service providers. All three of them are attorneys representing various jurisdictions in our network. We have with us Corina Salazar, who works at Centro de la Raza in Oakland, Alameda County, California. We have Sarah Plastino at the Rocky Mountain Immigrant Advocacy Network, or REMAIN, in Denver, Colorado. And we also have Aissa Olivarez at the Community Immigration Law Center, or SILC, in Dane County, Madison, Wisconsin. And each of them is going to give us a picture of what's happening on the ground in their respective communities in immigration detention and in court. So Corina, if you could pull your video up and your audio, could you please share with us what's going on in your area, Alameda County and Oakland? Please discuss ongoing ICE arrests and requirements to appear in immigration court, particularly in light of the lockdown orders that's happening in California.
Okay. Well, hello, everybody. Hopefully everybody is holding up well during these times. Just for a little bit of background, Centro Legal de la Raza is part of a collaborative that is called the Alameda County Immigrant Legal and Educational Partnership that was formed in 2017. Currently, there are several nonprofit organizations that collaborate within the network to respond to calls made by family members and friends of persons who are detained by ICE. Persons who are detained are usually from Alameda County or have Alameda County ties, who are sent to either Yuba County Detention Center or to Mesa Verde in Bakersfield. That's the location of where the video was taped and that you just saw moments ago. Just last Friday, ASILA, Centro Legal, along with the ASILA partners, held a virtual meeting with the mayor of Oakland, Libby Schaaf, to relay concerns of the community we work with regarding the use of law enforcement and the National Guard to curtail activity of the community during the COVID-19 shelter-in-place order. As all of us have clients, we have a big Guatemalan mom-speaking population that, of course, come from a country where seeing tanks and seeing persons with guns can be very terrifying. And of course, to begin to see something like that here, where they're seeking shelter, it can surely be re-traumatizing, to say the least, and very disconcerting. What Centro Legal is, basically we are fiscal leads in the collaborative, and we conduct the legal intakes for those persons who are detained. Usually we will either take the case after an intake for somebody who is detained, or we refer the case out sometimes to Alameda Public Defender's Office. Currently, we are funding for the undocumented community members who have been economically affected by COVID-19. And I'm going to do a plug here for our fundraising for that community. You can go to www.centrolegal.org/our-fund/. So that's just a little bit of background about the organizations that are involved in ASILA and about our organization. I think it's important to go back and kind of see what happened, a short chronology of the shelter in place and how all of this evolved. So basically, on March 4th, Governor Newsom declared a state of emergency for the state of California. Soon after that, we as an organization, management, began to discuss the possible closure of our physical office, and we began to discuss remote working with other organizations in the community in light of the declaration of the state of emergency. Basically, it was decided on the 12th of March that we would begin working remotely as an organization. And basically we started seeing other organizations start doing the same the week of the 16th. And of course, on March 17th, Alameda County, along with Contra Costa, Marin, San Francisco, San Mateo, and Santa Clara, effectuated a final shelter-in-place order that was to take place through April 7th, which of course now is extended through May 3rd. On the 19th of March, Governor Newsom signs an executive order for shelter in place, basically mirroring the same order that the 7 counties had agreed to. And of course now is also extended for the entire state through May 3rd. As of today, Santa Clara County appears to be the hardest hit by COVID-19 in the whole state. Alameda County has reported 373 positive cases, 9 deaths. San Francisco has a total positive cases of 450 with 7 deaths resulting from the infection. These are, of course, the numbers are expected, unfortunately, to increase over the next few weeks. In terms of enforcement, so prior to the shelter-in-place orders, we were seeing a ramped up ICE activity. Typically, we would field calls of maybe 1 to 3 persons detained per month. But in 1 week before the shelter in place, we heard that there were about 3 arrests in a 4-day span in Alameda. It seemed to have coincided with ICE's statement saying that they were going to still go out and arrest more people, especially in the sanctuary cities. So we suspect that that was in reaction to that declaration by ICE. All of the arrests we subsequently learned were persons who had prior removal orders or who had overstayed their visas. One of them had been told that ICE was arresting him because of a speeding ticket he had received the month before, but was also a visa overstay. So he was probably on ICE's radar. These arrests did happen outside of individuals' home with ICE waiting for people to exit their home before they were apprehended. Rapid response networks from neighboring counties mentioned that they'd also seen heightened ICE activity. In their cases, they were seeing courthouse arrests. ICE was entering criminal and traffic courts to arrest people they were targeting when they showed up for court. In Alameda County, we did, yes.
Corina, sorry, could I pause you right there? I just want to make sure we have room for our other speakers as well.
Sure.
Would you mind elaborating just for the next minute about requirements to appear in immigration court, how you're seeing this play out in your jurisdiction?
Sure. Basically, with the detained docket, the court had continued to require court appearances. There was not much instruction from the local court whether or not to appear in detained court. There was really not much instruction. I actually went to court last Wednesday. There were no wipes, there were no masks, there was no protection for me or for any other member any other person that was in court that day. What has happened since then, though, is that 2 of the detained judges in San Francisco, Judge Nelson and Park, have issued standing orders for detained hearings where attorneys would be allowed to appear telephonically for all master calendar, bond cases, reasonable fear reviews, or credible fear reviews. Persons on our staff are already appearing via telephone, which are directly connected to their cell phones. And they are also, of course, now allowing electronic filing. So despite these accommodations, there have been discussions with other Bay Area organizations regarding possibly boycotting the in-person court appearances of attorneys at all, whether it's merits or otherwise. This is still in the works and shaping. Some organizations have demonstrated or have expressed interest in the possibility of boycotting these merits hearings that may or may not be continuing to go forward in the next month or so.
Thank you, Corina. I appreciate that. And if there are further questions for Corina regarding the ongoing enforcement that we weren't able to fully flesh out, please do write those in the chat box and we can field those in the Q&A. Next, I want to turn to Sarah Plastino in Denver. Sarah, could you please speak to us for the next 4 or 5 minutes about detention access issues as well as advocacy efforts to push for the release of your clients?
Of course, and thank you so much everyone for being on with us today and for listening. We are a grant recipient through the Denver Immigrant Legal Services Fund, and so through that municipal funding, we provide representation on deportation defense for detained people at the Aurora, Colorado ICE Detention Center. So quickly on access, so we've had to dramatically adjust our client representation in light of COVID-19. We no longer do any in-person visits. We do all of our legal visits over the phone. We're working with the facility to set up a video chat platform, but it's been really logistically difficult to get that up and running, and we're sort of just now making inroads. We are concerned about our ability to continue psychological evaluations as evidence for a removal proceeding, to be able to have a psychologist interview someone in a secure setting, confidential setting. So we're still working on that, but so currently the legal visits have to be a no contact through a glass pane, but we're not going to the facility at all anyway. ICE recently required personal protective equipment, PPE, for all attorneys entering the facility, and we can't get our hands on it. And even if we could, I don't think as an organization we would be entering the facility at the moment. So we have to conduct all of our representation remotely, which is very challenging, and especially because the immigration court has remained open in Aurora. It closed for 2 days last week after 2 ICE officers were announced to be positive for COVID. So I imagine they may have been sanitizing the courtrooms, but it's still open and people are still having merits hearings, asylum hearings, etc. And so we've had to pivot to do those telephonically, which was never previously allowed. And obviously we have strong due process concerns with representing someone at their asylum trial telephonically, but it's really the only thing we can do right now because we don't have the equipment to enter the facility. So we did have an attorney win asylum last week telephonically, which was amazing. But, you know, at the hearing, the prosecutors tried to enter new evidence into the record that she hadn't had the ability to review in advance. So it raises lots of due process issues, and we're not sure, you know, ultimately we don't know if the client is prejudiced or not. So the other issue is that we have a Know Your Rights program called the Legal Orientation Program. And so we are having to do those intakes, legal screenings of people all over the phone, which is very cumbersome. And then also the Know Your Rights component of that is really difficult because it's generally in groups of people. So we're trying to set up some sort of video. So how does this affect our work? Obviously the due process concerns, the logistical hurdles, it decreases our efficiency and our ability to take on new clients because it's so logistically complicated trying to represent people and getting through to them. It's really hard to prepare a client's testimony remotely. We also have to balance our own safety with our clients' due process rights. So that makes us, you know, feel like we're in a really difficult position. We don't want to have to make those hard choices. And it also could potentially prejudice the outcome of our clients' cases. In terms of advocacy efforts, we've done a lot to push for release. First, I'd like to highlight our collaborations with medical professionals. We've done a ton of this. So you may have seen a letter by Dr. Carlos Franco Paredes, who is an infectious disease physician at Denver Health. And we worked with him to develop a letter calling for release of ICE detainees that has now been picked up in a lot of media outlets, and so it had a really large impact in terms of awareness. So we're very proud of that. We just got word that an op-ed is going to be published in the Denver Post this weekend that we co-authored with another doctor. And these same doctors are doing a sign-on letter among trying to get the large institutions to sign on to lobby the state and to lobby ICE. And we do also have a letter from mental health professionals who are talking about the impact of isolation on people who are quarantined in detention. We've also been doing a ton of humanitarian parole release requests for people with medical vulnerabilities. We've filed over 25 of those. And we also developed a pro se request form that we've been distributing to the detained people at Aurora and also to other organizations nationally, so that detained people can request humanitarian parole on their own. And we've outlined the different reasons that we think are persuasive in the context of the COVID outbreak. We've been trying to push getting people out on bond and other forms of parole. And we did a training this weekend, last 2 parts of full day training, specifically on training pro bono attorneys on how to obtain release for people in the context of the COVID outbreak. And we had over 45 participants and more remotely. So as a result of all of this, 40 of the people that we've worked with since the state of emergency declaration have been released. And we're really fighting to get more people released. We've also been featured in a lot of media, to basically calling on ICE and trying to reach a broader audience, calling on ICE to release people. So, you know, progress, but it's still just terrifying. There's a woman with 1 lung at GEO who we're trying to get out. And I mean, it's just stuff like this. It's really hard. You know, we had a woman today who said that she had all of the symptoms and she went to medical and they wouldn't give her a COVID test, and she's in the same unit as the woman with the 1 lung. And, you know, so, I mean, we're all terrified basically that our clients are going to die.
Yeah, that's really horrible. Thank you so much for sharing an incredibly robust update in a short amount of time. Congratulations on those victories, which are important to celebrate as we are moving through extreme challenges. And lastly, I'd like to move on to Aissa Olivarez at Dane County, Madison, Wisconsin. Aissa, could you also, in around 4 to 5 minutes, speak to the impacts of a mass ICE transfer that recently happened in your jurisdiction, and how that's impacting your ability to secure the release of your clients?
Yeah, definitely. So first, I just want to thank Vera for organizing this, and all of our partners who are doing advocacy and litigation around all of these issues. We're a very small nonprofit in Madison, Wisconsin, and currently serve Dane County residents who are detained at facilities now across the nation. What happened recently here in Wisconsin is we had a detention center that we are in the Kenosha County facility that has 200 beds. That facility, basically the sheriff in their agreement with ICE said, we're not going to allow anyone else in at this time. We think it's dangerous for the people that we house here. And ICE basically said that they weren't happy with that decision. And so instead of adhering to what the sheriff requested, they went ahead and pulled everybody that was there with ICE in that county facility, pulled them all out and transferred them to different places across the nation, including Illinois and as far away as Texas. And so the main facility that we serve, the Dodge County facility, which is about 45 miles north of Madison, it impacted our clients there. People got shifted around without notice. We weren't notified as attorneys that this was happening, and so we received a lot of panicked calls when family members, didn't get their daily call from their loved one. They hadn't heard from them, or maybe they looked in the ICE locator and they weren't appearing. And so we started getting panicked calls about our clients from Dodge, and we started making phone calls to ICE about why we hadn't been notified, trying to figure out what had gone on. And we were basically told, we have the discretion to move your clients anywhere across the nation that we want, where there's bed space. And so we weren't given a clear answer as to why people were being transferred, but it did impact our clients in a negative way. It meant that they were farther away from their family members here in Wisconsin. It's a 45-minute drive to the Dodge County facility and about a 90-minute drive to the Kenosha facility. And they were now being transferred to Pulaski, Illinois, 300 miles away. And so the inability for them to see their family members really was difficult for them emotionally. Family members were afraid. When my client was first transferred, she said she was taken into a part of the facility that seemingly hadn't been used for a while. And so they were asked to clean it. They were asked to clean the portion of the jail that they were going to be staying in so that they could live and stay in a place that was more cleanlier than it was when they arrived. And so people were very scared, and they continue to be very scared for their lives in these facilities. They say there's some precautions being taken in recent days. They noticed them wiping down things more often. And so they assume that it's because someone now is sick, because it wasn't happening before. So it's impacted our clients' relationships with their families. For example, I had one client who has her children in foster care at this time, and she has, daily calls that she needs to make to the foster mom. And when she was transferred multiple times in Illinois, she was unable to place these calls, and that placed her custody of her children at risk. Securing release from these clients who have been transferred has also been a major problem. Now, ICE currently has a policy that instead of being transferred to a local facility to be released in Chicago or Milwaukee here in Madison, or for people from Madison, instead people are being released directly from the detention center where they're being housed. And so what this means for families is that they have to drive 8 hours away, 300 miles south, to be able to pick up their loved one who has recently posted bond. We've had clients who haven't been able to post bond because our Milwaukee office that accepts bond payments and our Chicago office have been shut down. So that meant family members had to figure out how to get to Indianapolis to be able to post bonds, to be able to see their family members and be reunited with them. And so, we primarily serve low-income families. That's who we are serving. And they're just encountering so many hurdles on top of this uncertainty and fear. These hurdles.
Hi, Aissa, are you there? I see that Aissa just froze. So I'm just gonna move until Aissa can come back with us and finish that thought. But in the meantime, as she comes back with us, I just wanted to thank our legal service providers across the country in the safe jurisdictions and outside of the network for really participating and exposing the egregious conduct by ICE. Thank you, Corina, Sarah, and Aissa in particular on this call for talking to us about the problems happening in court, conditions in detention centers, and lifting up the voices of those who are detained and their family members whose voices would otherwise go unheard. And we'll try to get in touch with Aissa, but in the meantime, I will throw it back over to Annie to talk about how our government partners can get involved. And then if you have questions for these particular panelists, please drop them in the chat. Thanks.
Great. Thank you, Courtney. Thank you for Corina, Sarah, and to Corina, Sarah, and Aissa for the amazing work that you're doing. And I also want to take the opportunity to thank people on our team, Mayra, Arisal, Corey, and Liz, and of course, Courtney, who helped put this all together in a short amount of time. So why don't I want to start with kind of how you can take action as local government. These programs, as you can hear from the 3 legal services providers who are doing this work on the ground, these programs are more pressing than ever. Without lawyers connected to people in detention, individuals and families are completely alone at the worst time. So we know that you are all advocates for this work as part of the SAFE network. So please continue to protect these programs in your local budgets and let us know how we can help. You can speak out. It can be a voice promoting the need for release and to stop detention and deportation. It's critically linked to the public health of your local communities. You can please consider joining letters, publishing op-eds, putting out statements, or talking to your fellow local leaders. You can really use your role to remind federal entities working in your backyards that carrying out business as usual during this time is really a public health crisis, is contributing to the public health crisis, and contrary to whatever every person involved in the fight is asking of us at this moment. Please, send a clear message of compassion, unity, fairness, and basic dignity. You can coordinate with your local congressional delegations to demand access to council funding and also to call on ICE to release people. You can also stay connected to your peers in this network, and we hope that you continue to do that. We look forward to organizing additional webinars, remember to use our listserv. There's the SafeGov listserv and also the Safe LSP listserv. And reach out to the legal services providers and community groups that you partner with to ensure that they're being heard and to elevate their voices. So with that, I think I'm going to go to some of the comments and questions that came up in the chat box. Let's see. Well, I want to highlight actually quickly some of the local actions that you guys have taken the time to put in the chat box. St. Paul, Minnesota, Mayor Carter sent a letter to the local ICE office last week requesting that they release individuals, certain categories of individuals, including individuals in high-risk categories, such as people who are over 60, women who are pregnant, people with chronic illnesses, people with disabilities. So big thank you to Mayor Carter for that. In Ramsey County, Minnesota, the medical commissioner submitted an affidavit in support of a federal habeas petition. It's another example of a great partnership, and you've got both the city and the county there acting, which is really amazing. Let's see. Prince George's County, we're providing meals to all children Monday to Friday with 3 meals per day. And have increased that to address needs in the community, giving computers and free internet to all families without, and are looking to develop a fund to provide rental assistance, particularly for those who are undocumented. Thank you so much for sharing that. All right. I'm going to start. Please feel free to continue to share what actions you've taken or what you're considering with your peers on this network. And I am going to jump to Q&A. We only have a few minutes left. All right. Dr. Venters, it's been a while since we've been with you. If you're able, I'm going to bring a question to you. Sarah earlier was talking about her concerns about people in solitary confinement and detention. Could you talk a little bit about how you're seeing that being used and, why it's such a concern during this outbreak?
Sure. I think that there's a notion that locking people in cells results in less transmission of the virus or movement of the virus around. And you even see this mentioned in the CDC guidelines to some extent. I think this is problematic for many reasons. First of all, people know that they're being punished. They feel that they're being punished when they're locked in a cell by themselves. And so often putting people into a cell, locking them into a cell involves use of force or pushing them or handcuffing them, things that just increase physical interaction. One of the other fundamental flaws with this approach is that people get sick when they're in cells locked away. And this is why suicide is the #1 cause of death in county jails in this country, because the primary response to a mental health crisis to withdrawal has been up to now locking people away in a cell. So it promotes death. So the notion that we would take people who we know, particularly people who are at risk of serious illness and death from COVID-19 infection, and then place them into a locked cell where we will have the same set of casual surveillance through a window pane by correctional staff is only going to increase the likelihood that they die from this infection.
Thank you for that. You know, we're going to go a few minutes over, so I just want to let folks know because I want to make sure some of these questions come out for the panelists. But if you need to drop off now, it's, we understand. Let's see. Heidi, we're having a question about sort of federal advocacy efforts like habeas petitions or other federal litigation efforts targeted at ICE to release people from detention. Could you maybe say a little bit about what's happening? And you're muted if you're speaking.
I'm so sorry. Yes, absolutely. There's a dizzying number of lawsuits that have been filed across the country. And I can't get anywhere close to providing a comprehensive list here. I can share a couple recent examples. There's recently filed litigation on behalf of a group of individuals at high risk of vulnerability to the disease in jails that contract with ICE in Maryland. Another lawsuit seeking the release of a large group of medically vulnerable folks in the South, throughout Louisiana, Mississippi, and Alabama. And what I think is really incredible, and I won't try to list them all, but is that we're seeing a mix of organizations who are national in scope and who are the usual players on sort of immigration-related litigation, mixed in with local legal service providers who are jumping into litigation in some cases for the first time. And it's also a mix of cases that were pre-existing. So for example, there's a major piece of litigation led by an organization in Denver that advocates specifically for the rights of folks with disabilities in detention. And they've had a long-standing class action challenging the lack of access to care for folks with disabilities, and they have supplemented that action to focus specifically on seeking releases for COVID. So there's that kind of supplement that's happening to existing systemic challenges. And then there are a number of individual habeas petitions that I think most of the groups on the call, including NIJC, are bringing on behalf of particularly vulnerable clients. And then there's these lawsuits that are bringing together groups of medically vulnerable individuals. You know, the last thing I'll say too is that I am amazed and awed, and I'm sure you're all seeing in your communities, by the creativity with which people are standing up for those in detention. So I was just hearing about the lawsuit that I mentioned in Maryland, and that there's a partnership with local community advocates who showed their support for the individuals who were seeking their release through this lawsuit by driving around the immigration jail and sort of showing their support and demonstrating from their cars, since we can't safely do so in person now. And I apologize for my cat in the background.
Thank you, Heidi. I know my cat's actually been like meowing outside the door the entire time. I hope nobody heard her. All right. We're over time, so I see some really great questions, but I am going to, end with one question that is coming from Council Member Denny Taveras from Prince George's County in Maryland. Let's see. Does Vera know of any letter we can sign on to? Are we considering a joint letter or statement as the SAFE network? That's a great question, and that is something that we're considering. If anybody here is interested, any of the government folks are interested in signing on to a statement, I think it would be very powerful to make a statement as the network, especially as a group of localities that have already made a statement in terms of standing up for immigrants in their communities. So, we'd be happy to be in touch. If you have any interest in this, please reach out to me directly or to your site lead after this call. And, we also have sample, language. If you want to put out your own letter, we're happy to support you on that. We also have, communication support. We'd be happy to help draft an RFP or to help, I'm sorry, not an RFP, an op-ed, and to help place something like that, or a letter to the editor, and just to help think through those different ideas with you. Unfortunately, I see a couple of other really great questions, but unfortunately we are out of time, and I just want to say thank you for everybody being on this call, and for finding the time in your very busy schedules right now. We are going to continue this conversation offline on our listservs, and please stay in touch with Vera and with each other and this community. Thank you so much for all the work that you're doing.
Thank you.
All right. Bye, everybody. Thank you.
Thank you so much. Take care, everyone.